Welcome to another episode of ResearchMD, where I tried to kind of simplify some research articles that apply to you all. So this article is a New England Journal of Medicine, which is like the holy grail for doctors to publish in. And we're going to talk about a study that was done by Dr. Bailey and team, and it's basically talking about sciatica, and if you have sciatica for 4 months to 12 months, is it more beneficial to have surgery, or is it better to do exercise, kind of pain medications? So, what is sciatica first? It's an irritation of the sciatic nerve, and if you have it, you probably know what it is because it's extremely painful. It's shooting pains from the buttocks down all the way to the back of your leg, all the way down to your toes. And there are prior research that have shown that those who have sciatica immediately and get surgery have more rapid relief of symptoms than for those who don't have surgery. But pain relief is more or less the same at 1 year follow-up and 2 years, regardless if you had surgery or not. Now, Dr. Bailey wanted to find out, for those with sciatica, due to a disc herniation, which kind of presses on the sciatic nerve at the level of the lumbar 4, lumbar 5, and lumbar 5, sacral 1 region, basically different regions of your spine, for those who had this pain for 4 to 12 months. Would surgery be better, or would non-surgery be better, or would they be the same? What kind of surgery is involved in sciatica treatment? It's called a microdiscectomy for those who have the herniation. Basically, you have a herniation pressing on your sciatic nerve, and you just cut that protrusion that's pressing on your sciatic nerve. So this study focuses on surgery versus 6 months of not doing surgery. And what that 6 months entails are education, activity and exercises, pain medications, steroid injections, and physiotherapy. And so how did they do this study? It was a randomized study in Ontario, Canada. It was at one hospital, and patients recruited were 18 to 60 years old, and they had to have one-sided sciatica. God bless those who have both, because that sounds really bad. But for this study, it was just one-sided, and they had to have the pain for 4 to 12 months, or in between. And the sciatica was specifically due to a herniation. And so basically they had 128 people that fulfilled this criteria, and 64 were randomized to the surgery group, and 64 were randomized to 6 months of non-surgery. And before they did the surgery, or before they did the non-surgical interventions, they asked them, hey, how's your leg pain? How's your sciatica? And then they asked this throughout 6 weeks, 3 months, 6 months, and 1 year. Their main focus was what their pain score was at 6 months. For those assigned surgery, they had around a median time of 3.1 weeks when they actually received the surgery from when they were assigned that group. So what were the results? At 6 months, the patients in the surgery group, they had a pain score of 2.8, lower number being more controlled. And in the non-surgery group, they had 5.2, and this was statistically significant, meaning that this is much less likely due to chance. But important to note that those in the surgery group, 9 patients had adverse events, including skin infections, post-operative neurologic pain, and 1 patient even had recurrent surgery after having another herniation. So these are things to be mindful of. Surgery is not only, even though it's promising, there are always complications. Weaknesses of the study that we have to know are that of the 64 patients who received non-surgical care, 22 of them, which is 34%, crossed over to get surgery at a median of 11 months. This was a single center study, so the results are not as generalizable to other hospitals that might have different types of patients. And 20% of the data were missing because some people were lost to follow up. Some people did not adhere to the intervention, whether surgery or non-surgery. But bottom line, this study suggests for those who have sciatica for 4 to 12 months, if you get surgery, you're more likely to have less pain after 6 months than if you did not receive surgery. And this surgery being microdiscectomy.